Thank you all for being here.
Turn it up.
I want to thank Vista
Congressman,
Knoll.
1 second.
Oh,
Let me turn it up.
hold that thought.
We also. Give me a test.
Testing. 1, 2.
A little more, Kyle.
A little more.
Go ahead again.
Testing. 1, 2, 3.
Go ahead again.
Testing. 1, 2, 3.
Echo, sorry. There we
Oh,
go.
it's an echo.
Yeah. Are we got?
Okay, good. Technology.
That's the volume over there. Godlike technology. Well, we've got the. This is what's picking up for the media camera.
Okay, so just go ahead.
Yep, go ahead.
Good morning. Thank you for being here. I want to thank Vista Knoll in particular for hosting us today and for all the work that you're doing to ensure seniors in our community live with dignity. I'm Congressman Mike Levin. I proudly represent the 49th Congressional District, including here in beautiful Vista. And I'm here today to sound the alarm because House Republicans, President Trump, are pushing the largest cut to Medicaid in our nation's history. It's not just reckless, it's shameful. Let's be clear about what's happening. House Republicans are planning to rip away health care from kids with disabilities, seniors in nursing homes like this one, and even our veterans, all to pay for massive tax breaks for billionaires like Elon Musk. You heard me right. They're proposing up to $880 billion in cuts to Medicaid for tax breaks for the wealthiest Americans. If they get their way, seniors will be kicked out of nursing homes like the one behind me. Hospitals will reduce services or be forced to close altogether. Kids with disabilities will lose the care they rely on, and working families will be left with nowhere to turn. People will die. And why? So the ultra-wealthy and the biggest corporations can get a tax break. This is personal for me. My dad ran nursing homes for over 20 years. I saw firsthand how Medicaid, or Medi-Cal as it's known here in California, is the lifeline for seniors, families, people with disabilities, and veterans. You heard me right about veterans. Medicaid covers 1 in 10 of them. These are men and women who served our country. And now House Republicans want to rip away the care they count on. It's appalling. Right here at Vista Knoll, 60% of patients rely on Medi-Cal. Think of that, 60%. If Republicans slash Medi-Cal, places like this will be at great risk, leaving seniors with nowhere to go but the streets in some cases. And it's not just seniors and veterans. Medicaid covers 1 in 3 Californians overall. Kids, parents, people with disabilities. Without it, they lose access to doctors, medications, nursing care, and the services that keep them healthy and safe. So what specifically would the Republican plan cut? One big thing is called the Federal Medical Assistance Percentage, or FMAP. It's a formula that decides how much federal funding California gets for Medicaid. If that formula is cut, California would then be forced to either make devastating cuts to health care or somehow find billions of dollars out of thin air to fill the gap. Either way, families lose. It means fewer doctors taking Medicaid patients. It means longer wait times at hospitals. It means healthcare workers losing their jobs. And it means nursing homes and community clinics shutting down, leaving families stranded. Again, why? So billionaires like Musk can get even richer. This isn't just a bad policy, it is a moral disgrace and a heist. We're talking about kids with disabilities losing access to the care they need to walk, talk, or even breathe. Seniors kicked out of their nursing homes with nowhere to go. Veterans who served our country left without the care they've earned. Parents forced to choose between paying rent or taking their child to the doctor. And this is not an accident by the Republicans. It is a choice. They're choosing their billionaire donors over your health. I am fighting back. As a member of the Appropriations Committee, I'm using every tool I have. Legislation, litigation, communication, and mobilization to block these cuts, to protect Medicaid, and to make sure families in our community and across the country get the care they deserve. Because in America, your health care should not depend on the size of your bank account. And no senior, no veteran, no child with a disability, and no family should ever have to suffer so that a billionaire like Elon Musk can get a tax break. We're going to fight like hell to stop this scam and to protect Medicaid for the millions of Americans who count on it every day. Now I'd like to turn it over to Gabriel Albano to share how these cuts would impact him. Gabriel. We're going to get you this mic. Kyle?
Yes, my name is Gabriel Albano. I live in a skilled nursing facility here in this area, Vista, California. I've been injured roughly 8 years ago. Without these medical assistants, the people that are working in this field, I wouldn't be in this position as I am now. But also, there's individuals that are in the same home, in many homes across the nation, that are bedridden. They're still getting the same treatment. But what it is that, there's individuals just like me that are willing to sacrifice. And here's what the whole thing is, that I truly believe there has to be a sacrifice for the individuals that are in the home, and also there's a great sacrifice for the people who are treating the individuals. But this is like a trickling effect. If it affects the patient, it's also going to affect the people who are serving the patient. So it's going to be really bad for the whole nation in itself. But if we can get people to agree on this and go against what is being said in the Congress, that we could fight against this, I think it would help all of us. And in the book of Hebrews it says, God wants to be pleased for what is shared upon the people, not taken away, but what is shared. So I just want to thank you for listening, and I appreciate this time for having this time. Thank you very much.
Thank you, Gabriel.
Thank you.
And now I'd like to turn it to Dr. Jean Ma from Tri-City to discuss the impact on hospitals. Dr. Ma.
Good morning. My name is Dr. Jean Ma, and I am an emergency room doctor and hospital CEO. I want to thank Congressman Levin for taking a stand to protect health care for all Californians. A study done in 2023 revealed 1 in 5 California hospitals were at risk of closure, and half of all hospitals were in the red. Entering 2025, not much has changed, as healthcare in the U.S. remains precariously fragile. A poorly conceived, impulsive approach to once again go back to the same well and make drastic cuts to an already underfunded Medicaid, Medi-Cal program fails to recognize the dire consequences on our under-resourced healthcare system. These cuts will cause irreparable damage to the most vulnerable among us. But let me be very clear. Cuts in Medicaid will negatively impact every American and every hospital in every community. Facilities will be forced to respond by closing or reducing services. Timely access to care and specialty services will diminish for all. And emergency rooms will become increasingly inaccessible. Do not be fooled. Cutting Medicaid doesn't mean those costs go away. It just means those costs will be passed along to taxpayers and consumers in the form of additional taxes and inflation on healthcare. This is an existential moment in the health of our communities. So I urge you to contact your congressman today and voice your opposition to Medicaid cuts before it's too late. Thank you.
Thank you, Dr. Ma. I think that counts as contacting your congressman today. And now I'll turn it to Director of this nursing home, Dr. Luis Navazo.
Not this nursing home.
Oh,
Thank
not
you.
this nursing
Not-
home.
not
but
this
the
one.
Nursing home director.
Thank you.
Sorry.
Yeah, I was briefly elevated in position here. Thank you all for having me here. Thank you, Congressman,
Thank you.
for the ability to speak to my community regarding a subject that is of daily importance to me, that of the ability to serve my patients. My patients live in this facility and in other facilities across this county. The majority of which, as previously mentioned, more than 60% of the residents in facilities like this are custodial patients. These are patients who count on this as most likely their last home during their lives. These are the lucky people that manage to get into facilities like this. Many of you in the community make comments and have made comments over the last decade about the problem of homelessness. Those lucky few amongst the homeless community that are able to find a spot in these facilities are admitted, but there's countless others that don't have that opportunity. With proposed budgetary cuts, the likelihood that openings in facilities like this will be available will decrease markedly. As a member of the California Association of Long-Term Care Medicine, I care for my patients as a physician. Otherwise, I wouldn't be doing what I do. And it is at times a thankless job. As Dr. Ma will tell you, we take care of patients in different settings, patients with difficult issues. The majority of the patients in these facilities have some sort of psychiatric diagnosis. This could be your Aunt Mary, your Uncle Bobby, your brother, your sister. It could be your children. If there are less places for those individuals to find a home, the likelihood that they're going to be out on the streets in the population that many of you are quick to judge and condemn is quite high. So it is a difficult enough industry to provide the care. We, as physicians, are partners with the nursing home facilities. Over the last 9 years, there's been approximately 750,000 beds lost across the United States. 15 million people across this country count on facilities like this as their homes. That's significant. It's a little bit heartbreaking, but to think that an 80-year-old aunt or uncle might be out on the streets trying to take care of their insulin needs or administer their psychiatric medications is heartbreaking, truly. It will make our collective work much more difficult. I'm going to close with a quote from Mahatma Gandhi. The greatness of a country is measured on how it treats its weakest members. That's something for all of us to consider. I thank you for the opportunity to address you, and be well and be healthy.
Thank you so much. That was beautifully said. Now I'm going to turn it over to a home care provider, Sabrina Bishop.
Thank you.
Hello, my name is Sabrina Bishop, and I am a home care provider. I provide in-home support services which is called IHSS. I am also a proud union member of United Domestic Workers for UDW here in San Diego. I have been a provider for 6 years. First, caring for my mother, who one day, like many, slipped and fell and went from being independent to now totally dependent on someone else to care for her. Shortly after being on the IHS program, my mom had another slip and fall, but this time, she passed away. I knew I could go and find work, maybe at Target, In-N-Out Burger, where I could make more money than being an IHSS care provider. But you know what? I didn't do that. You know why? Because I am a care provider. Now I have a client. His name is Mike. Mike has end-stage dementia. His wife was his caregiver. They had no children. Unfortunately, she wore her body down taking care of Mike. She refused to pass away because she wanted to know who was going to take care of her husband for 53 years. But she knew that there was an IHSS care program that provided services for her husband. When I informed her that I would be Mike's care provider, she was allowed to go in peace because she knew that there was a program that was going to be here to care for her husband. Now, we're facing these major cuts. $880 billion. Too bad we can't give $880 billion to the Medicaid program. Boy, how would that change so many lives? To protect a program that some of us one day may need. You have a cushy job today, but a slip and fall. You will no longer have that job because you will no longer be employed. You will no longer have that coverage. You might need Medicaid. Don't be so quick to cut it, because one day, the program that you plan on cutting today, you may very well need yourself. With these cuts, it could mean putting my client Mike in the shower, but not having enough time to get him out. Too bad, I gotta go. Not enough hours. For me, cutting this program would be making a difference between paying my rent to have a roof over my head so I myself are not homeless, or buying groceries for the week. Not the month, the week. And for what? To give millionaires and billionaires more money? How can we allow our caregivers, our seniors, our disabled individuals, and maybe even you one day yourself, to be the people that take the burden for the rich and the wealthy? Without this IHSS program, Mike would not be alive today. These are the real consequences of these cuts. People's lives are at stake. People's jobs are at stake. Don't be so quick to cut a program you or your family member may one day need. We must band together, all of us, now, to protect these programs. Every member of Congress, we need you to stand with us. Every member of the community, we need you to stand with us. Let's protect this program. Keep your hands off our Medicaid. Thank you, and have a great day.
Well, I also want to thank everybody here at Vista Knoll for letting us disrupt you a little bit this morning. I want to thank my team for putting this together. I want to thank my dad, because when my dad, he reads the news every morning, and when he saw news about these cuts to Medicaid, he was the very first to sound the alarm to me. And he let me know in no uncertain terms what it would mean for our community, for our region, in terms of the economic impact, obviously the loss of care, the loss of services, and the potential for this devastating harm to people. And before I said my introductory remarks, I asked our experts behind me, I don't want to be over-exaggerating. This really could mean seniors on the street. This really could mean that some skilled nursing facilities, some hospitals would be forced to shut their doors. And the answer was a resounding yes. They are the experts, not me. But I think we all owe it to ourselves to listen when it comes to the real world cuts, the real world impact of the cuts that are being proposed. So with that, I want to thank everybody for being here, and I hope everybody has a great rest of their day and a good weekend. Take care.
Shout it, raise it, that's what you do.
Okay, are you done?